Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Colon polyps. Introduction. A polyp is an extra piece of tissue that grows inside your body. A polyp that forms on the inner lining of the colon is called a colon polyp. Although most colon polyps don't do any damage, some become cancerous over time. About 1 in 15 people develop colon cancer. It can be life-threatening, but if it is found early, it is a highly curable form of cancer. This program explains colon polyps. It discusses the symptoms, causes, and risk factors for the condition. It also provides information on treatment options and prevention methods.
Anatomy of the colon. The last part of your digestive tract is a long, muscular tube called the large intestine. The colon makes up most of the large intestine.
The colon has several components: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus.
The colon's main function is to absorb water, nutrients, salt, and other minerals. What is left is turned into waste, also known as stools or poop. Your rectum stores waste until it is eliminated from the body. Symptoms.
Colon polyps may not cause any symptoms. Your healthcare provider might be the first to notice one during an exam. When colon polyps do have symptoms, they may include blood in your stool, changes in bowel habits that last longer than a week, constipation or diarrhea, rectal bleeding. Sometimes a large colon polyp may block your bowel. This can lead to abdominal cramps and pain, nausea or vomiting, severe constipation.
Some polyps may not show any symptoms until they have become cancerous. This is why it is important to try and find them early. See your healthcare provider if you notice blood in your stool. You should also see your healthcare provider if you have changes in your bowel habits that last longer than 1 week. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes.
The majority of colon polyps are not cancerous. Yet, like most cancers, polyps are the result of abnormal cell growth. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing abnormal growth. In the colon and rectum, uncontrolled cell growth may result in polyps. Over many years, some of these polyps may become malignant or cancerous.
Polyps can form anywhere in your large intestine. They can be small and flat, large and flat, mushroom-shaped and attached to a stalk. In general, the larger a polyp, the greater the likelihood of cancer. There are 3 main types of colon polyps: adenomatous, hyperplastic, inflammatory.
A number of factors may increase your risk of colon polyps and colon cancer. These include age. The majority of people with polyps are over age 50. An inactive lifestyle. Being overweight or obese. Family history. Inflammatory bowel diseases such as ulcerative colitis and Crohn's disease. Tobacco and alcohol use. Having a parent, sibling, or child with colon polyps puts you at a higher risk of developing polyps or cancer. The more family members with polyps, the greater your risk.
Another risk factor for colon polyps is gene changes. A small percentage of colon cancers result from conditions that cause these changes. These conditions include familial adenomatous polyposis, or FAP, Gardner syndrome, Lynch syndrome, MYH-associated polyposis or MAP, Peutz-Jeghers syndrome or PJS. Diagnosis.
Almost every case of colon cancer develops from polyps, but polyps grow slowly, often over a period of years. Screening helps your healthcare provider find non-cancerous polyps and colorectal cancer in its early stages.
You should be screened regularly for colon polyps if you are age 50 or older. You have risk factors for developing colon cancer. People with a high risk of colon cancer should begin regular screening much earlier than age 50.
A colonoscopy is the most common method of screening for colon polyps. During a colonoscopy, your healthcare provider looks at your entire colon and rectum with a tube attached to a camera. The tube is inserted into your anus and rectum. Colonoscopy is the most sensitive test that detects polyps and cancer. If any polyps are found during the exam, your healthcare provider often removes them for testing. Other tissue samples may be taken for testing as well.
If you have a family history of colorectal cancer, you may be a candidate for genetic testing. This blood test may help determine if you are at an increased risk of colon or rectal cancer.
Other screening methods that help find colon polyps are barium enema, computerized tomographic colonography or virtual colonoscopy, flexible sigmoidoscopy, capsule endoscopy, stool tests to check for blood.
Treatment.
Most colon polyps do not cause any problems, but the earlier polyps are removed, the less likely it is that they will become cancerous. Healthcare providers can usually find and take out colon polyps during a colonoscopy. People who had one or more than one adenomatous polyp removed will likely need follow-up colonoscopies every 3 to 5 years. Your healthcare provider will suggest the best follow-up schedule for you. Surgery is sometimes needed for large colon polyps that are attached to a large section of the colon wall. It's usually unsafe to try to remove these polyps during a colonoscopy. These may turn into cancer more often.
In cases of rare inherited syndromes, your healthcare provider may recommend surgery to remove your entire colon and rectum. This is known as a total proctocolectomy. A pouch is made from the end of your small intestine and attached directly to your anus. This allows you to expel waste normally.
If cancer is found, you will begin treatment for colorectal cancer. This may include surgery, chemotherapy, targeted therapy, radiation therapy, immunotherapy, or some combination of these treatments.
Prevention. You can greatly reduce your risk of colon polyps and colorectal cancer by having regular screenings. You can also reduce your risk by making certain changes in your diet and lifestyle. Get enough calcium and vitamin D. These nutrients reduce the risk of colorectal cancer. Good food sources of calcium include skim or low-fat milk and other dairy products, broccoli, and kale. You get vitamin D from milk products, egg yolks, fish, and sunlight. Include plenty of fruits, vegetables, and whole grains in your diet. These foods are high in fiber, which may cut your risk of developing colon polyps. Fruits and vegetables also contain antioxidants, which may help prevent cancer. Watch your fat intake. Certain types of fat can increase your risk of colon cancer. It is important to limit saturated fats from red meat as well as processed meat, such as hot dogs or sausage. Limit saturated fat to no more than 10% of your daily calorie intake. Drinking alcohol may increase your risk of colon polyps and cancer. Do not use tobacco products. Smoking and other forms of tobacco use can increase your risk of colon cancer and a wide range of other diseases. Stay physically active and maintain a healthy body weight. Regular aspirin use may reduce your risk of polyps, but aspirin use can increase your risk of gastrointestinal bleeding. Talk to your healthcare provider before starting an aspirin regimen.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
A polyp is an extra piece of tissue that grows inside your body. A polyp that forms on the inner lining of the colon is called a colon polyp. Colon polyps may not cause any symptoms. Your healthcare provider might be the first to notice it during an exam. When colon polyps do have symptoms, they may include blood in your stool, changes in bowel habits that last longer than a week, constipation or diarrhea, rectal bleeding. The majority of colon polyps are not cancerous. Most colon polyps can be identified and removed during a colonoscopy. Screening helps your healthcare provider find non-cancerous polyps and colorectal cancer in its early stages. You should be screened regularly for colon polyps if you are age 50 or older. You have risk factors for developing colon cancer. People with a high risk of colon cancer should begin regular screening much earlier than age 50.
You can greatly reduce your risk of colon polyps and colorectal cancer by having regular screenings. You can also reduce your risk by making certain changes in your diet and lifestyle.
Thank you for using Explain.